Hello, how are you? And good afternoon. This is the Lisa Baxter Show. That's right, we are going live again today. So you'll see me more than once, but I just wanted to say hello to you. Today, we're going to be talking about transplant centers, transplant diet, and those kind of things. All right, so I wanted to talk to you about those things, okay? I wanted to also get right to it, and then I'll talk about some other stuff. Let me see. What is a transplant center, right? To find out, to find out if you have a kidney transplant, you will need to be seen by the transplant team at a transplant center. A transplant center is a department in a hospital with staff that is experienced in kidney transplants. So that's exactly what it really is. All right. To find a kidney transplant center near you, you can visit. They have scientific registry of transplant recipients, and they have another one called organ procurement and transplant network. All right, that's OPTN. Okay, all right. So this is the website. You probably really can't see it, but I wanted you to get an idea. We got Transplant 101 going on again. All right. If you have a private insurance, you may be asked to use a certain transplant center. Your dialysis care team can help you with this. So you still got help from the dialysis, your care team at dialysis, and then now you have the transplant center that can also help you. Okay? All right. Multiple transplant waiting list. Okay. You are allowed to be listed on more than one transplant waiting list. This may increase your chances of getting a transplant sooner. However, you cannot be on two hospital lists in the same region. Okay, so don't have it in the same region. So you can still do more than one. All right. Getting listed in multiple hospitals in the same area will not increase your chances of getting a transplant sooner. This is because kidneys are issued locally and regionally. So that's why. Okay. It is important to look into your choices of transplant centers be by asking yourself these questions. Now ask yourself, think about it. There will there will be many appointments because before and after the transplant. Trust me, they are. All right. Will I be able to get there for them? All right. So yeah, you're there. So you just gotta be prepared, ready, and waiting once you get it. Well, don't worry. Everything is work. Being on dialysis is work. Being on having a transplant is work, but it's doable work. How about that? Okay. Will I be able to easily get to the transplant center? Do you have transportation? I took Accessoride. Some hospitals have their own transportation for you. They didn't give me that choice or anything. And then my insurance didn't cover something they said. So thank God that I had Accessoride. I have Accessoride, I got Able Ride, I got Stat. But those are Long Island places, in New York. But Accessoride go all five boroughs. And that one was in another borough. Okay? Here we go. Okay. Okay. An offer of a kidney may come any time of the day or the night. Would I have an issue getting there quickly for the offer? That's right. I was sitting at work and the thing rung and nobody was at the job. So I said, oh my God. Let me wait if somebody come. But honey, when they found out I had a kidney waiting for me, they said, "Please get out of here. Go, get, yeah, go, go, girl, get out of here. Go." I just wanted to make sure everything was all right and in place because I knew once I went, that mean I was on leave. You know what I mean? So permanently on leave, they wouldn't be able to come and I couldn't be able to sign a paper and all of that. But they knew I was waiting. So I mean, just be prepared. Get your ducks in a row. Get your stuff in order. All right. So that's just important. Right after surgery, I will need someone to help me. Trust me. I had my husband, I had my sister, all of that, but they passed away and I ain't have anybody. But family members will help. They were so glad that I got the kidney. So my church, New Life Cathedral in Brooklyn, jumped in. Some of the saints from that. Some of my family members, my nieces, Tashana had jumped in. You know what I mean? So I had some people jumping in. Marjorie, my niece Marjorie, my nephew's wife. Oh my God, she jumped in. I wanted a dish. Vangela Curtin, she jumped in. She made my favorite dish and everything like that. Jenny Lynn Hoyt, she had her son bring me water and stuff because I wasn't allowed to go to a supermarket or anything. So you got to put these things in order. You wonder, they don't even want to let you go home without help. You know what I mean? Or put things in place. Once they found out my husband died, they was asking me 1,000 questions. Well, who gonna take care of you? So that was daycare, and they don't want anything to happen to you because stuff can happen. You feel sore or hurt, your wound, and then the nurses come in, So I had to get a home attendant. I didn't want a home attendant my whole life, and I even worked as a home attendant. But that's the first time in my life I got one, and it wasn't a bad thing. We're still friends to this day, 4 years later into my transplant. All right. A caregiver, usually a family member or a loved one. If the center is not near my home, will my family or caregiver be able to stay close by? Because some people might not want to stay in the house with you or live with you or anything like that. I don't know how you are sick, you know what I mean? I usually have done things myself. I lived by myself 12 years before I was married, and that was a hard thing. But you don't think nothing of it when you're sick. I could call one of my sisters up and say, hey, and they would have came. My sisters and brothers, we were always very close. We always took care of each other. And I buried most of them now. They had polycystic kidney disease. They had some other things going on as well, and some things was a mistake from a hospital or a doctor. One died on the kidney machine itself. Okay, so the dialysis machine. So that hurt the family, and it would hurt your family. Trust me. So you just want to get things ready. You want to get things running. Does the transplant center take my insurance? So you just got, those are just food for thought. Give you an idea. So you pick out your center, get with your center. How about that? Meet your transplant team. Wow. It's nice to have a team. Okay? A team of people. All right. As the patient, you are the most important member of the team because you know your body best. God knows you know your body best. Trust me. And some of that medication might make you sick, dizzy, hard to swallow because there's a lot of pills to take in. I was never taking, any medicine or pills really. I had the dialysis treatment and maybe one pill if I had that. And then you go from that to a whole bunch of pills. So, but it gets reduced. So you can look forward to it getting reduced. Some people stuff is reduced more than mine, and I was asking the doctor about it. But as long as the kidney is working, I call my kidney Hannah. I named it after a baby my husband and I always wanted to have. We wanted Hannah and Ephraim. Well, are supposed to be our children's name, and since I had so many miscarriages, a lot of times with kidney disease and stuff, it's very hard to carry a baby. I know some that did. You know what I mean? As a matter of fact, one was on my show, So, and then I had a client, I'm a social worker, and she was able also to have a child. You know what I mean? She had the dialysis every day. I was willing to do anything to have a child. I tried to wait till I was 50. All right? 57, going to be 58 next month. But anywho, right? Okay, so your transplant team, getting to know the transplant team will help you to be active in your care. You always want to have something to say in your care. You know what I mean? It's hard to take so much dictation and say nothing. So, feel free about what's going on with you while you're dealing with your transplant. You don't just want to sit there and be a puppet. You don't have to be. All right. You got rights. It's good to look up this stuff, research this stuff, do your homework. Do your homework. All right. You don't have to take my word for it or anybody on any of these shows or anything. You can do your own homework. You can talk to your own doctor or team yourself. You know what I mean? But we're friendly and we want it for you. How about that? Okay. So, you can tell the team what you need. Tell them your needs. You can also tell your care team how you are feeling, you know, and you can work with your healthcare team to make decisions, you know. You have a thing for everything. I remember the guy was telling me how to set the medications up, right? And you had to get that down pat, and how to put it in order, when to take it, what time to take, and you taking it all in, while healing at the same time. I had something in my neck, I had something in my unmentionable, I had something in my side, I had the drainage thing and stuff like that going on, I had the intravenous. You know what I mean? So I'm walking around with my poles and stuff like that, and everything. I didn't have no problem walking around and getting up because I like moving around. I can't just stay in the bed. I was never like that anyway. But you will feel sore enough to lay down. Trust me, sore enough to stay in the bed. But stuff is doable and movable. You can work with it. You're so glad that you don't have dialysis anymore. You're so glad to try to work with this stuff. Okay, let's see where we're going to go now. The transplant surgery. He or she has special training in kidney transplants. So you got your surgeon, right? The social worker helps you and your family know about what to expect in the process. Okay? The social worker will share resources with you. The person can help handle issues related to your transplant process. All right. This may include paying for transplant or medications needed after your transplant. He or she can counsel you personal coping kidney diseases and my social worker seemed a little limited on stuff. And since I'm a social worker, I'm one that likes to give out. I only supposed to help the person with childcare, but I like to help with jobs, apartments, and stuff like that, referral things. And sometimes all they have is the one thing. Even at dialysis, I couldn't understand that I thought they would have a load of resources, and they only help you with your insurance, making sure that everything runs smooth with dialysis, make sure everything runs smooth with your transplant and stuff like that. They're not going any further than that. But you ask and you try. And sometimes they'll know a center or a place that can help you also with certain things. You know what I mean? But mostly dealing with insurance. They do a lot with that. So I guess they just, they want to get paid. And the hospital want to get paid. So they make sure they're on top of that. The kidney doctor is also called a nephrologist. He or she will help you for you the best outcomes for your kidney transplant. So they get together. So you don't only have that. I have my kidney doctor too. She can be very nice, and everything. And they were all nice in the beginning, and then now it's hard to find them. It's hard to be bothered. They got somebody new that had a transplant, so all of their attention is going on that, and all their feelings is going on that. That was hard for me to swallow at first, but I understand. I'm a big girl. You know what I mean? All right. The transplant coordinator is usually a nurse practitioner or a physician assistant. He or she will oversee your evaluation, treatment plan, and follow-up. If you have a problem with them, you can always change them. I was going to change, but I decided not to change because I went so far into with them. But you don't have to do that because I had some issues with them because mine was snappy. You know what I mean? And rough. You know what I mean? And I didn't understand what was wrong with them. So the doctor said, "Oh, she have a lot of patients." I know, but don't throw that on me. I can't throw my problems out on my clients and stuff like that. Or, the fact that I had a lot of death in the family or had a kidney disease, ram. No, I cannot do that. You got to put your professional hat and clothes on and be professional. Cry in a corner later. You know what I mean? And that's what I did sometimes. You know what I mean? Especially when sometimes you hear horrific stories. But anywho, the pharmacist will review your medicines with you. He or she will talk with you and help you make things safe for all medications, for your health condition. The dietitian, check this out. The dietitian is an expert in nutrition, right? Who will help you to plan the amounts of food to eat. You gotta measure it up. After a while, with your eye, you will know. You know what I mean? I used to do a cup of this, a cup of that. Half a cup of this, half a cup of that. And they was telling me you gotta eat more. You ain't eating enough. And you ain't drinking enough water. I wasn't used to drinking much water because of being on dialysis 12 years. But I'm learning, and I'm over there. I got a big thing of water I just finished, and then I'll drink another one. I try to drink as much as possible. And they said, oh, they count the other fluids too. Thank God. And I love water. I couldn't. That's the first thing. I couldn't wait to get the water. I was disappointed when they told me I couldn't have that much water when I was on dialysis. You know what I'm saying? So, yes, she will help you, on your current health and the issues that you're dealing with, when it comes to food and nutrition, with your fluids, your drinks, and all kind of stuff. Your healthcare team is everyone who will help manage part of your medical condition. Mm-hmm. All right. If you may include your family doctor, a specialist, or the primary care provider, they can coordinate medical care with your transplant team. Now, that's one thing I always did. Even when I was in a dialysis center, I wanted my doctors to know each other, and some of them did know each other, and then some of them had dual titles. So my primary now is also my nephrologist. But even at the hospital, when I have a nephrologist, I have a nephrologist there too. You know what I mean? So, I have them have the emails and everything, send stuff, share stuff, the whole bit. And if they didn't or don't, I take a report to the other one. So either way, they going to know. Because I want them to be able to take care of me. Because I've dealt with being poisoned by a doctor, Stephen Johnson syndrome, almost died and everything like that. I don't want to go through that. I've been through some serious stuff in my life. And don't push me to go nowhere else with it. All right, kidney transplant protection from infection. You don't want no infection, trust me. Nobody do. Infection can work bad with you. All right. In the first 6 months after surgery, transplant patients may have a high risk for getting an infection. People love you. They want to see you. They want to hug you. They want to kiss you. They want to talk to you. Nobody hardly ever came to the house. All right. When they did come, I stood my distance. I had stuff on. You couldn't be around animals, small children. Small children love you. They do all of this and they hug you and kiss you. They don't mean no harm. You know what I mean? You can't afford that. All right. So I kept my distance good, and stuff like that. And when I went back to work, if somebody had a cold or the classroom, they told me somebody was sick in that class, I didn't go in the class at all. And I did put my mask on and I wore it. This is way before the pandemic. Mm-hmm. Yeah, I wanted to make sure I got to protect Hannah. All right. There are important things you can do to protect yourself from getting an infection after you have received a transplant or stop before or become too serious. You don't want it to become too serious so you can stop it before it gets out of hand. All right? Okay. Some of the important things that you could do. Keep your hands clean. Use soap, hand sanitizers to kill germs. All right. Ask your caregivers, your members of your family, your health team, and your friends to do the same thing. So just because you wash your hands, anybody got to wash their hands. All right? All right. Mm-hmm. Do not go to a crowded place like crowded stores, movies, restaurants, and churches. I miss church. Ooh, I missed it a lot. And I got a big church now. I remember when it was small, but honey, it's big now. I've been there when it started. And now, ooh, I was 16, so you take it from there. So I didn't go. I watched it if I could watch it. Bishop used to send me tapes or something like that, or he did that when I was 6 years ago too, when there were tapes and stuff like that. But I mean, there was a ways to. So I watched it on TV, somebody else church TV, whatever. But I didn't go to the crowd. All right. Avoid uncooked. Mm, Nothing raw. I had to talk to restaurants and people many times. And I had to look and make sure, you got to be careful. I miss having sandwiches, but they be cutting with the blade. And sometimes, you know how they take the dish rag and they just do like that. Come on. I don't see no soap and water, cross contamination, raw stuff been on it, been sitting there for a long time. Come on. I don't need it on my sandwich. You don't need it on your sandwich either. All right. So, all right. So don't do that. All right. So let me see. Avoid uncooked. Like sushi. All right. You don't want nothing raw to eat. No shellfish or nothing like that. Do not have grapefruit or grapefruit juice or pomegranate juice, anything like that, which can cause a drug interaction. This dietitian as your transplant center can help you to understand foods to avoid. All right. So I know not to drink grapefruit juice. Boy, I miss it. I used to slice it and eat it like that. Oh my goodness. But you couldn't pay me to have it though. That or pomegranate juice. Pomegranate juice was all right with me, but I think one time somebody gave me a candy or something like that. I freaked out. I called, told Dr. John. He said, "Lisa, don't worry about it. It's all right." You know what I mean? Get vaccinated. Your doctor will suggest certain shots to help you prevent infection. Like one of them for the flu or pneumonia, hepatitis B. These shots are important to help you stay well. When I was on dialysis, I hated the flu shot. I said, no, I ain't get no flu shot. And yes, I didn't have it. And one day the doctor sat down and told me what could happen and this and that. I said, what? Where is it? Where is it? So brush and floss your teeth every day. See your dentist regularly. Bacteria may be common in the mouth that can cause infections that will spread to the rest of your body. I had gum disease for the longest. And like I said, my teeth won't fit in my mouth, my false teeth. And because they stay so swollen, sometimes you'll see my face fat, but sometimes the prednisone does that also, make it fatter. But I'm having issues with that. And that bothers me because I didn't want to do the show with no teeth. And the dentist ain't answering the phone. But I keep it 1,000 with you. You know what I mean? I got some pain going on too. They don't give me nothing for that. You see me sitting different ways and stuff. They're trying to be comfortable. I got different chairs. Shando, Korobo Shia. Stay away from people that are sick and not feeling well. No visits for them. Okay? Come back when you're healthy. Come back when you feel better. All right. And that's not being mean or rude. And they'll learn to understand that. Because some people like, oh, listen, God, girl, give me a hug. What you talking about? I went through hell. You know what I mean? I was healthy on dialysis, but still, I don't want to go back. I ain't gonna do nothing stupid to go back. And it only takes a little thing. So we can all learn together. We can all be educated together. How about that? Be involved in your care. hmm Be sure to follow the directions of any medication that you are prescribed. Take your prescribed stuff. Do not skip doses or medications. Every miss is a single dose may make it more likely for your organ to reject. You don't want no rejection. Don't do it. All right. The only time you should skip a dose if your doctor or the other healthcare team member tells you to do so. I ain't never been told what. Thank you, Jesus. All right. So let's see now. Yeah, we going with this. All right. Let me see. I don't try not to go. I like to try to keep my shows 30 minutes, but I want to be able to get it all in. And I like to be able to talk to you guys too. Be myself. Be real. Be open and stuff like that. Post transplant kidney diet. hmm Good nutrition is always important. Eating a healthy diet may play an important role in recovering after your transplant. I know they keep saying eat more meat. I don't like meat that much. You know what I mean? But I used to eat a children's hamburger, and that used to help my blood when I was on dialysis. So I had to learn how to balance things out with the meat and the protein because I felt different when I didn't have it. No bean was going to help me with that. I'm sorry. I already been a vegetarian and everything like that. And I just felt different. I felt like I couldn't hardly stand up. I felt weak, weird. All I had is a couple of bites of that baby burger. And I'm telling you, I was fine. You know what I mean? And I was better. That's me. I don't know about you, but that's how my body works. I don't eat on time. I get sick. I'm surprised nothing's wrong with me while I'm talking to you because I haven't had breakfast yet. So, but I got stuff downstairs and I'm going to have it. And I'll be back after that. Okay. All right. The dietitian at the transplant center will explain the kidney diet so you will understand and feel confident in your food choices. So you got a choice of what you eat, but you got to be confident and you got to be educated before it goes in. All right. After your transplant, I had ice cream. I'm like, what? He was like, have an ice cream. I was so used to the other diet because before I got on dialysis, I had to eat low protein, to keep the kidneys from failing or, keep what little bit of function I had left, you know. But then you had the renal diet was whole way different from your transplant diet. I ain't mad at you. So you be able to eat more things. It is also important to watch your blood pressure. Avoid salty foods. This will help you from swelling if you have diabetes or continue to follow a diabetic diet. All right? Okay. The dietitian may also recommend, this is what she might recommend. See the picture? I don't know. Yes. All right. Eating high fiber foods. High fiber foods. You got your grains and stuff like that out there. You know what I mean? I mean, oatmeal is always helpful. It helps you. A lot of the stuff helps you stay regular. And it could taste good too. It don't have to be bad tasting because it helps you regulate and stuff like that. All right. Having 5 servings of fruit and vegetables each day that can be fresh, frozen, or dried. Now you can have dry fruit. Remember on dialysis, boy, you couldn't eat no dry fruit. Raisin, you can't have no raisin dates. You know, and stuff like that. Or those dried up fruit. Those dried up fruits too. All right. No eating a grapefruit or drinking grapefruit juice. We know that. You know what I mean? Drink low fat and low milk. I stayed with that. I didn't know if I can ever go back, and I didn't want to rock the boat, and I became fine with it. I remember I used to like the regular milk, and then I had to have that milk with a lot of calcium in it. Oh, that was thick, that milk. You hear me? So now I drink this milk. All right. Eating lean meats, trimming all the fat. I know fat give flavor sometimes, but trim it off. All right. All right. Before you cook it. All right. And this will include beef, flank steak, chicken, turkey, and fish like halibut and salmon. Okay. Drinking at least 2 liters, that's 68 ounces of water each day. Woo! I kept forcing myself to drink water. I start throwing the water up, but I was like that even as a kid. If I'm too full or had too much, it's not going to stay down. If I had anything that I don't like, it won't stay down. Okay. A registered dietitian can give you tips to help you adjust with your new diet. All right. And don't keep the food out. Bacteria grows on stuff when you keep food out. So be careful keeping food out, even when you thawing it out to cook it. Be careful with all of that. Also, no, I didn't see it in this, but I remember they told me no food. Those bars that you go to and you get the food out is all laid out for you. No buffet. I just love the buffet. You hear me? I like to go when it's clean, and I like to go before everybody best over it and stuff like that. And I miss that, but no buffets. I went to a birthday party or something. My sister had something, and they had the buffet this minute. I told them, no, I can't eat no buffet. I said, take mine out the kitchen, bring it to me straight, And it's hard because it's hard to pay for it like that since they do it that way. And I said, listen, I can't come to no party with no buffet unless you talk to the cook or the people or let me talk to them or something because I paid the whole thing and I'm not going to be able to get everything everybody's getting. I like to be able to get something or at least get it before they touch it or bother it. I went through some stuff with that. But you live and learn and you do what you can. You know what I'm trying to say? You do. Yes, you do. I wanted to show you some of my medications and stuff like that. This is my other thing that I use. See, and this is the night and this is the day, and my medications inside, and it's from, Sunday to Saturday. All right. Yeah. My niece bought this for me. Jay. Juan's wife. They always buy me something, even this laptop I'm talking to you on. All right, remember your gloves. Keep safe. I fell in love with this glove when I saw it. Pink. I got so many different gloves and stuff I use. I use the gloves because I just very cautious because I'm riding on accessorizing and stuff, and I don't know who got what and who's doing what. This is different. I wanted to show you the different masks. This is a cloth mask I got, black or grayish. This is the other one that I got. But the thing, Petra gave this to me. Tashana gave this one to me. Juan Bravo gave these to me, my nephew. This is white. He had a pack of 5 of that. And this is from AKP. I have some custom made ones too. I couldn't find to show you. But at another time, maybe I'll be able to show you. All right. One, it says the Lisa Baxter Show. And I have one that says Blessed Kidney Connections from my company that I'm the CEO and founder of. And this is the one that they say that's good to wear. And I have the other one downstairs in my walker. The other one they took you to wear. That was really tight. I could barely breathe in that. Excuse me. And I just wanted to show you. This is chicken fajita from the National Kidney Foundation and recipes. I love to share recipes and stuff like that. I do. I really do. And sometimes you'll see it hanging up. And, I hang all kind of stuff up all around. I love the, where is it? This is to bring awareness to people see you wearing this bracelet. I love these bracelets. I give some out. I had some for my show. This one is from Fresenius. Okay. But they're all green. Sometimes the same shade. And I like to wear the orange ones also as well. And the shield. I will wear my shield a minute in public. If I need to, I have to wear my shield. Okay? Because you have to be protected in this thing. If you ill, sick, elderly, or senior, or somebody's dealing with asthma and things of this nature. This is my cell set. All right. And they'll give you a pharmacy. They'll give you a suggested pharmacy. Sometimes you can use your own, but the one I have, they deliver my medications to me, and that's always good. All right. This is the baby aspirins I have to take. And this is my prograph. And when I became diabetic this year, back in February, all right, this is my grip side. I have to hold it upside down because when you hold it this way, it falls over. So I have to do it that way. All right. This is my prednisone. And this is my Norvasc. It was 5 milligrams, now it's 10. I didn't want to take the 10 milligrams at first. And this is my little kid when it comes to checking diabetes. To see the little thing and thing with the needles. I hate the little needle thing. All right, but this is it, and it's so cute. And now the little booklet to write down everything that I need when it comes to the diabetes and stuff like that. Trying to stay well and safe, keeping my hand sanitizer. I even have to spray alcohol. I try to keep it good, real good hand washing, and it's very crucial. All right, you see my arts and crafts that keeps me busy. You know what I mean? I'm trying to stay a little festive while for the season. These are the little things we made when I was in Florida last year, the glass. And, you see the little bowls. We were able to design them and stuff like that. I do hook rug, latch hook, crocheting and stuff like that. Oh, I'm just a stickler when it comes to these things. And it's fun to do with the family, fun to do with friends, fun to do if you're by yourself and alone as well. It gives you something to do, make a nice gift for family and friends. This is one of my wood projects that I did. And I never found clothespins so big, but they were big. And let me see if I have my rocking chairs, the big and the small. All right. Isn't that cute? Oh, nice. And it's easy to do. And clothespins cost about $1. All you need is one pack, and you can make a nice little chair. You can shellac it if you want and everything. Festive and good and great for the holidays. With a baby one. This is the baby one. Is that adorable or what? Is that cute? What? Whoa, whoa, whoa. And that was also easy to make. One time, my supervisor had got the wrong type of clothespins, and I said, I wonder what it would look like if it was small. So I did it. It was more challenging because they were small, but it was still doable. How about that? So you could do anything with your family, fun and games. You know, just gonna give it to you and show it to you. Is that crafty or what? I think it was Home Depot that had these giant things. I didn't see them, I believe, in Pennsylvania when I went to visit my niece, Tawana, and her daughter, Melody, and Latrell, who also all been on the show. Okay, so I love you guys. God bless. Take care. Thank you. Happy New Year. Thank you for all your love and support, your friendship and prayers, keeping your girl good. All right? So take care of your kidneys and they'll take care of you. That's my slogan. Be well, be good, be safe, be for victory. I got that from my mother. She always said that even when she was sick in the hospital before she passed. She would always say V for victory. She was saying that even when she was out of the hospital. I miss her too. Well, you guys be good, great. Be good to yourself. Be good to your family. This is your girl, Lisa Baxter, keeping it real. Keep giving you the 411 in the kidney world. This is the Lisa Baxter Show, giving you the 411 in the kidney world. Ha.